Dana Miller presents the 9th Annual Obesity Conference, a practical look at obesity, diabetes, and current strategies. Featuring Jennifer Ligibel, MD, Obesity and Cancer.
So I want to go ahead and introduce Dr. Jennifer. I always have problems with her name. Is it Ligibel? Ligibel, okay. She's an associate professor at Harvard Medical School and the director of the Leonard Zakim Center for Integrative Therapies and Healthy Living at the Dana-Farber Cancer Institute. Dr. Ligibel's research focuses on the impact of lifestyle interventions on cancer-related outcomes in women with breast cancer. She's conducted a number of studies looking at the impact of exercise and weight loss interventions on patients' quality of life and symptoms after cancer diagnosis, and is currently leading the NCI-funded phase 3 clinical trial that will test the impact of weight loss intervention upon the risk of disease recurrence in more than 3,000 overweight and obese women with early-stage breast cancer. So we're more and more realizing the association of cancers. And I must say, one of my one of the more increasing groups of physicians who are referring to me for obesity medicine are oncologists, and I'm really pleased to see that. So without further ado, let's thank Dr. Ligibel for being here.
Thank you very much. Thank you very much for inviting me here to be here this morning. I'm sorry, my flight was delayed a few times last night, so I will get the word finding down in a few minutes. But so I'm going to talk this morning about the link between obesity and cancer, and really I'll just do this then. Kind of the overarching goal is to overview the really rapidly growing literature suggesting that body weight impacts not only the risk of developing malignancy, but for people who are diagnosed with early stage, potentially curable malignancies, may also impact the risk of recurrence and mortality, which is why you're seeing potentially more oncologists referring their patients after treatment to think about different weight loss strategies. So I'm going to talk both about the observational data that's sort of linking weight to cancer risk and cancer outcomes, and then talk about what we know about weight loss, whether it could reduce the risk of developing breast cancer and other cancers. And I will say I'm a breast oncologist, so those words come naturally to my mouth, but also the bulk of this evidence at this point is really in just a few cancers, and so there's a lot of room for additional work. We know a lot about breast cancer, colon cancer, and prostate cancer, not so much about some of the other malignancies, and we'll talk a little bit about the evolution of these data in some other cancers. And then we'll finish by talking about the trial that I'm leading, looking at weight loss as a potential treatment for breast cancer. We're hoping that other cancers will soon follow, and that you all may be increasingly involved in the care of patients with early cancers. So I often start this talk with a slide that shows the prevalence of obesity in the United States. Oncologists are often not aware of that. I imagine that this audience is probably pretty aware that obesity is a very common condition here in the United States and increasingly around the world. But what sometimes people don't recognize is that in addition to the impact of obesity on the risk of things like diabetes and heart disease, there's growing literature that excess body weight puts individuals at risk of developing malignancy. Interest in this area really started in the early 2000s with the publication of this report. It was a study that looked at the relationship between body weight and the risk of developing and dying from cancer. So it was looking at cancer mortality in a group of about 1 million US adults. They were followed for 16 years, and they looked at the relationship between body weight and cancer mortality. And what they found, and this was a figure looking at the relationship between BMI and cancer mortality in women, there's a very similar figure in men. When they looked at the heaviest members of this cohort, and they were generally, and it varies a little bit from malignancy to malignancy, but usually people with a BMI of either 35 or 40 or above, they found that the heaviest members of the cohort were at increased risk of several different malignancies. The magnitude of that increase ranged from relatively modest levels of increase for things like multiple myeloma and colon cancer, all the way up to a 6-fold increase in the risk of fatal uterine cancer. So really showing fairly large increases in risk of malignancy associated with body weight. This study really opened the door to hundreds of studies looking at the relationship between body weight and the risk of developing malignancy. There are two groups that have really sought to summarize this literature. At this point, I don't tell people not to try to look at individual studies because there are so many of them, but there have been two really good meta-analyses of these data. The first of these was from the International Agency for Research in Cancer, which is a part of the World Health Organization. In 2016, they compiled an expert panel of about 30 people to sift through the more than 1,000 studies looking at the relationship between body weight and cancer risk, with the goal of determining in which malignancies was there consistent evidence. The group had also convened about 10 years earlier and had come up with a list of 8 malignancies for which there was consistent evidence of relationship between adiposity and cancer risk. They termed this body fatness. I will say I was on this panel, and this was the subject of an almost day's debate, whether you called it obesity or excess adiposity. They settled on body fatness, but it's really sort of looking at the relationship between obesity and cancer risk. And we determined at that point that there was convincing evidence that there was an increased risk of developing 13 individual malignancies associated with excess body weight, with 3 additional malignancies where the evidence was really starting to emerge. So clearly, there is a strong connection between excess body weight and the risk of developing several different malignancies. The other group that has looked at this is the World Cancer Research Fund, the WCRF. They have a little bit different process, but they've come up with almost exactly the same list of malignancies that are associated with excess weight. Now, we know that people don't become obese sort of in a vacuum, and there are different factors that influence weight. There's many of them that you will explore in this conference, but kind of in simplistic terms, because I'm an oncologist and we don't get into the whatever that molecule you talked about in the basic science literature. But we think about, your weight is a reflection of your genes, but also of the energy that you expend through physical activity and your diet. And there have been a number of reports that have not only linked body weight to cancer risk, but also independently physical activity and to a less extent diet. So this was a pooled analysis that was published around the same time as the IARC panel looking at the relationship between obesity and cancer. And this pooled data from 12 European and US cohorts of adults who did not have cancer when they entered these cohorts. They completed a self-reported measure of physical activity, and then they followed these individuals for 11 years. And they found in this group of about 1.4 million individuals, again, a relationship between higher levels of physical activity being linked to lower levels of malignancy. And again, this was sort of looking at highest levels of activity versus lowest. A lot of the cancers are the same: breast cancer, colon cancer, prostate cancer. But you can see some protective effect of physical activity, and these analyses were adjusted for BMI. So there does seem to be an association between other aspects of energy balance and the risk of developing malignancy. Diet is a lot messier. I think any of you who've tried to study diet in patients know that there's sort of what people write down that they're eating or report to the person who's calling them up trying to get their food for the last 24 hours and what they're actually eating. And I think that that makes this type of research a little bit messier. There's also the fact that we don't know whether if somebody has a diet that has a lot of fruits, vegetables, lean meats, that it's that they're eating that or that they're not eating the French fries and the hamburgers that would be the kind of controversial diet. The WCRF, the World Cancer Research Fund, publishes something called the Third Expert Report. And this is really a nice publication. The newest one just came out that tries to summarize all of the data for weight, physical activity, and different dietary intakes and the risk of developing each different malignancy that they look at. And what you can see here, they report this out as generally a series of grids grading the strength of the evidence. This specifically looks at diet. And the red boxes show, and I don't expect that you'd be able to read this, but it's a nice resource to go to and look at, well, what's really the strength of the evidence linking something like red meat and colon cancer? As a high-level overview, most of the dietary intakes either come in the inconsistent evidence or the moderate. There are very few dietary factors that have been strongly linked to the risk of developing malignancy. The exceptions to that are the relationship between red meat and colon cancer. There is also a relationship between pickled and preserved foods and stomach cancer, less common here, but very common in Asia because of some of the dietary patterns. And there's also a relationship between alcohol intake and the risk of things like hepatocellular cancer, head and neck cancer, and increasingly breast cancer, for reasons that we're trying to understand better. So we all know that rates of obesity, inactivity, and poor dietary quality are pretty high here in the United States and increasingly elsewhere around the world. So there have been some attempts to summarize, well, what is this doing to the risk of developing cancer? If we think that there are 13 different cancers that are impacted by body weight, how does the fact that we've gone from a society where obesity was relatively uncommon 30 years ago to one where more than a third of US adults are obese? And I think not surprisingly, that has led to a significant increase in the risk of malignancy. This was a modeling assessment that was done looking at SEER data. They estimated that an average person in the United States in some areas weighed up to 18 kilograms now, more now than they did 30 years ago, and that every year obesity directly causes about almost 90,000 cancer cases in the United States, and this number is expected to increase. There have been some estimates that over the next 20 years there will be about 1 million cancer cases attributable to obesity in the United States if we continue to see an increase in obesity. So this is clearly something that obesity, I think we have enough data at this point to definitively say that obesity increases the risk of malignancy. But the real question, as physicians, as obesity medicine specialists, can we intervene and change that trajectory? Can we lower cancer rates by helping people to lose weight? And so I think that unfortunately, we have much, I'm sorry, this is a little, the way that this is, there is much less information about the impact of weight change through an intervention, whether that be lifestyle, medication, or surgery, and the risk of developing malignancy. There are no randomized trials that have sought to look at whether weight loss is a cancer prevention strategy that should be prescribed to people. But we do have a few levels of supportive evidence from some trials that looked at, well, what about changing diet? So not focusing on changing weight, but what if you help people change their diet? And the biggest example of this is a trial that was launched now more than 30 years ago called the Women's Health Initiative. This is the only trial that has been conducted specifically looking at the impact of a lifestyle change on the risk of developing malignancy, which is an editorial comment I would say is an enormous missed opportunity given how strong we know the relationships between lifestyle factors and cancer risk are. But this is the one study that's been done looking at whether you can prevent cancer by helping someone change their lifestyle. And it was a trial that was conducted in the 80s and 90s, and so it focused on dietary fat. All of you who've been in this field for a while know that at that point that was really thought to be the key to everything, was you just lower fat. And so the study as a whole was part of a much larger initiative. So the Women's Health Initiative included 161,000 postmenopausal women who had not had cancer. Part of them were followed as an observational study, and then there were 3 embedded randomized trials, one of them looking at the impact of a low-fat diet, one of them looking at the impact of postmenopausal hormone replacement therapy, and then the other one looking at calcium and vitamin D supplementation. And all of them were looking at the impact of these interventions on cancer risk as well as a number of other outcomes like diabetes and heart disease. So in order to take part in this study, you had to be between age 50 and 75, you had to be postmenopausal, you had to be planning to reside in the area for at least 3 years. You can see here this was really a nationwide effort. There were sites that were collecting women for this study all over the country. Specifically looking at the dietary modification trial, this was a really big effort. Almost 50,000 women were included in this randomized trial. Women were randomized 2-to-1 to a low-fat dietary intervention that was delivered in groups all over the country, or to their usual diet. They needed to consume at least 32% of their calories from fat, so a pretty typical US diet, in order to participate in this study. And the goal was to get dietary fat down to 20% of calories, at the same time increasing fruits, vegetables, and grains. The primary endpoint of the study was looking at the impact of this intervention on the risk of developing breast and colorectal cancer, but they were also interested in looking at any cancer, and then more specifically at endometrial and ovarian cancer. Here you can see the flow. They screened about 373,000 women. The majority of those patients were not interested or already consumed a low-fat diet. They ended up with 56,000 eligible patients and randomized the 48,000. They had very good retention in the study over the follow-up period. Looking at the impact of the intervention, they did have a fairly modest, about an 8% absolute reduction in dietary fat at the first year, and that really was counterbalanced by an increase in carbohydrate intake, which I think we can talk a little bit more. I think that the view of carbohydrates has really changed since this study was launched, but really people sort of replaced their fat, especially with the fruit and other grains that they were taking in place of the fat. And what you can see here is looking at weight change over time. There was a modest weight loss in the first year that was attenuated over time, but the two groups remained statistically different, which you can be statistically different with 50,000 patients without a whole lot of an absolute difference in weight. Again, this was not a weight loss study. It was really a dietary quality study. And unfortunately, and this was now more than 10 years ago these results were presented, there was no difference in rates of developing overall malignancy in the patients who were randomized to this low-fat dietary intervention versus control. And when they looked at individual malignancies, the two primary outcomes of breast cancer and colon cancer, there was a 9% decrease in the risk of breast cancer that was not statistically significant. There was a non-significant increase, for reasons people don't understand, in the risk of developing colorectal cancer. The only malignancy there where there was some suggestion of a reduction in the risk of developing the cancer was ovarian cancer, and you can see that the risk was significantly lower with a hazard ratio of 0.83. This was, again, based on very few cases. This is a fairly uncommon malignancy, and no difference in the risk of endometrial cancer. So unfortunately, this study was overall judged to be a negative trial. I think it was a huge effort that didn't unfortunately demonstrate a whole lot of value of at least this dietary approach on the risk of developing malignancy. But this effort has led to a lot of subsequent reports. This was a huge group of women that were followed with food frequency questionnaires, serial weights, and so there's a lot of other things that we've learned from this analysis. And in the recent years, there have been a few studies that have looked at weight change and cancer risk. Now, these people that took part in these two analyses were not part of the randomized trial that we looked at, but were part of that big observational cohort of the 100,000 women who filled out the same measures but did not take part in an intervention or control group. So in this study, these two studies that have been recently reported, people were weighed by study staff at baseline and again 3 years after enrollment. And then there was a self-reported weight 6 years later. So this was a really big group of patients with serial weights. And earlier last year, there was analysis published that looked at weight change in breast cancer incidence, looking to see whether the weight change that people developed without taking part in an intervention may have an impact on their risk of developing malignancy. And you can see here that there was some evidence that greater than 5% weight loss was associated with a slight decrease in the risk of developing breast cancer, about a 12% decrease. Now, I think one of the things that's a little bit confusing is they did ask patients if they lost weight, whether it was on purpose or unintentional weight loss. And we know that unintentional weight loss is usually bad, and it is an indicator of some sort of underlying comorbidity. In this analysis, they found that there was actually a numerically greater relationship between unintentional weight loss and breast cancer risk, which doesn't make a lot of sense. So it does kind of raise a little bit of a question about this analysis, but this is one of the first studies that has suggested that losing weight in your postmenopausal years may actually have a beneficial effect on the risk of developing breast cancer. The other analysis that was reported from this same cohort looked at the risk of endometrial cancer. As you remember from that first graph, endometrial cancer is probably the cancer that has been most tightly linked to obesity in terms of the risk of developing the disease. And so in this analysis, there were 566 endometrial cancers that developed. Again, this was weight measured at baseline in year 3, and they asked patients again whether the weight loss had been intentional. And this time, they saw really a very nice relationship between intentional weight loss specifically and a reduction in the risk of endometrial cancer. So these are observational reports. They're certainly subject to a lot of bias, but suggesting for the first time that even weight loss at that point in life may be associated with a lower risk of developing malignancy. The one other trial I briefly want to talk about, and most of you are probably familiar with this study overall, it was a study that was designed to look at reduction in cardiovascular events, diabetes, and other metabolic outcomes. The PREDIMED study was a trial that looked at the Mediterranean diet in postmenopausal Italian women, Spanish-Italian. Women that were on the Mediterranean. And so in this study, patients were randomized to one of 3 diets: a Mediterranean diet supplemented with extra virgin olive oil, supplemented with nuts, or to a usual diet control that were given a basic low-fat dietary pattern, but they weren't really given the type of intervention or any supplemental materials like the virgin olive oil or the nuts to change their diet. The women who took part in this study were older. The average age was 67. They had a BMI of 30. Most of the women had hypertension, and about half had type 2 diabetes. So this was a population clearly that was at high risk of cardiovascular disease. As a secondary outcome, they were also interested in looking at the risk of developing breast cancer. And although there were a relatively small number of breast cancers that occurred in this cohort, they did see a significant reduction, especially in the women who were randomized to the Mediterranean diet supplemented with the extra virgin olive oil. So, I think that with the small number of cases, even a few additional patients diagnosed with breast cancer could change some of these relationships, but a pretty dramatic reduction in this early analysis of breast cancer outcomes in women who were randomized to this diet. So I think that these are certainly not definitive data suggesting that if you are seeing an obese patient, you can tell her with certainty, if you lose weight, you're going to cut your risk of developing breast cancer or other cancers by X amount, but suggesting that obesity may be modifiable even later in life in a way that could potentially impact risk of subsequent cancers. The strongest evidence that modifying body weight impacts the risk of developing malignancy comes from the bariatric surgery literature. And I think this is not surprising because the amount of weight loss that you see through bariatric surgery certainly dwarfs these lifestyle efforts, especially in women who are not taking part in an intervention. These data look at the risk of developing malignancy overall in a number of different bariatric surgery series. Now, in these analyses, it's important to recognize these are not randomized trials. They pair individuals who go through bariatric surgery with BMI, usually age and gender matched individuals, and they look at the relative risk of malignancy in the 2 groups. So there may be other things that drive who goes through bariatric surgery versus who doesn't that could influence this, but the studies have all shown a fairly dramatic reduction in the risk of developing malignancy in individuals who go through bariatric surgery compared to those who don't. This meta-analysis demonstrated about a 50% reduction in cancer risk in individuals after bariatric surgery compared to their matched controls. I think one of the things that's been interesting as this data have emerged over the last few years is looking at some of the individual malignancies that have been linked to obesity. And so this looks by cancer type at some of the 13 malignancies that we've seen linked to obesity. And what you can see here is that there are very clear reductions in things like endometrial cancer, here, postmenopausal breast cancer. So clearly suggesting that the risk of individual malignancies may be modified through bariatric surgery. And I think that as this data matures, we will get more and more information about the relationship between obesity and bariatric surgery. So weight loss for primary cancer prevention, I think it's clear that obesity is a risk factor for many different malignancies. I think that the data that we have suggesting that losing weight may impact the risk of malignancy is still emerging. I think there's some really promising information, but I think unfortunately there's not likely to be another women's health initiative where we're able to look in a large group of people directly at the impact of a weight loss intervention, whether that be lifestyle, medication, or potentially surgery on cancer risk at this point. So we're probably going to have to make do with this type of secondary analyses at this time. So I think that there's certainly, as you're counseling your patients, enough information to say that we think that in addition to lowering your risk of developing heart disease and diabetes, cancer is probably something that will also be favorably impacted through weight loss. But what about for the person who's already developed malignancy? And I think this is a growing group of patients around the country and around the world. There will be an estimated 20 million cancer survivors in the United States by 2023. And a lot of these patients are long-term survivors of things like breast cancer, colorectal cancer, prostate cancer. There are many lifestyle questions that arise in these patients, and I think we're learning more and more about the potential for intervening after cancer diagnosis and treatment to see if that may help improve their overall outcomes. Because most people who are diagnosed with an early stage malignancy carry that risk of recurrence and subsequent mortality for many years afterwards. And so we're often looking for adjuvant treatments, thinking about ways to improve their outcomes long term. Now, the reason that we're interested in weight reduction, increased physical activity, or dietary change in improving cancer outcomes really, again, comes from a large body of observational evidence connecting lifestyle to cancer recurrence and mortality. This is a meta-analysis that was now published a few years ago of almost 100 individual studies looking at the relationship between a woman's weight when she's diagnosed with breast cancer and her risk of dying from breast cancer or other causes in the subsequent years. So these analyses demonstrate that if a woman is obese when she's diagnosed with breast cancer, she has a 35% higher risk of dying from breast cancer and a 41% higher risk of dying from any cause in the years after her cancer diagnosis. And this is balanced for the treatment that she got, the stage of her cancer, and other factors. The other thing that's very important about this meta-analysis is that they looked at younger and older patients separately. A lot of the data that has linked weight to the risk of developing cancer in the first place has suggested that obesity seems to be primarily a risk factor for breast cancer after menopause. This analysis, looking at the relationship between obesity and cancer death in women diagnosed with early stage, potentially curable cancers, shows that if anything, that relationship is stronger in younger women. We don't understand why this would flip when you're talking about primary risk versus secondary risk of recurrence and mortality, but this has been seen uniformly through multiple different studies showing that younger women who are obese are also at increased risk of mortality from their cancer, as are postmenopausal women. The data are strongest in breast cancer, but there are emerging data in several other malignancies. Endometrial cancer, also an association between increased body weight and poor outcomes. This is also true in prostate cancer. Prostate cancer is actually fairly interesting. There is not a clear relationship between obesity and increased risk of prostate cancer overall, but we're increasingly realizing that prostate cancer is not really one disease. If you follow men in their 90s, almost all of them would have prostate cancer, but usually it's a low-grade cancer that is fairly indolent. There is a subset of prostate cancers that tend to be much more aggressive, much more likely to metastasize, involving younger individuals. And there is a higher risk of these biologically aggressive prostate cancers in heavier men. This analysis also suggests that individuals who go through standard treatments, things like surgery, radiation for early prostate cancer, have a higher risk of prostate cancer progression if they're heavier versus leaner. So after diagnosis, there appears to be an ongoing relationship between weight and the person's outcomes, whether they ultimately survive their disease or it recurs and becomes fatal. Now again, obesity is a reflection of many other things. There are studies that have also looked at physical activity patterns after diagnosis and the risk of cancer-related mortality. And what these studies, although there's not the 100 studies there are looking at body weight, tend to suggest also that people who are more physically active have a lower risk of cancer-related mortality. And this is true for breast cancer, where there's about a 40% lower risk of cancer-related mortality for people who exercise at least 3 hours a week. This is true for colon cancer and prostate cancer. It's interesting that the estimates are about the same in all three groups. Again, these are based on about a dozen studies altogether, so there's a lot more work that's needed in this area, but there seems to be a consistent signal arising that physical activity after diagnosis is linked to lower risk of cancer-related mortality. Diet, again, diet has been less studied in terms of outcomes after diagnosis. There is some evidence that suggests that lower fat diets might be helpful. Diets that are higher in fiber and higher in protein may be linked to lower risk of recurrence in breast cancer and maybe colon cancer. But I would say that the dietary evaluation has been pretty messy and inconsistent for the most part in terms of how it relates to the risk of recurrence and mortality in individuals with early stage disease. Now again, if we're thinking specifically about weight loss, there's just not a lot of evidence looking at the impact of weight loss on cancer outcomes. Unfortunately, there have been some studies that have tried to look at weight change over time, looking at weight gain versus weight loss, but the studies are sort of all over the place, and that often comes from the fact that after somebody goes through cancer treatment, a lot of the weight loss that happens, if it's not in direct response to an intervention, is due to the toxicity of the therapy, due to undiagnosed metastatic disease. So we don't have a lot of observational data that can help us hypothesize whether weight loss after diagnosis actually improves outcomes. But there are a couple of studies, again, these were trials that were launched around the same time of the Women's Health Initiative that looked at changing dietary fat and whether that would have an impact on the risk of cancer recurrence. And although, again, we don't think that the key to a successful diet is low fat, these studies do tell us a few things about the potential benefits of changing lifestyle factors after a cancer diagnosis. The first of these studies was a trial called the Women's Interventional Nutrition Study, or WINS trial. This was a trial that enrolled around 2,400 women who had gone through treatment for early breast cancer. So they'd already finished their surgery, their chemotherapy, their radiation. They could be taking tamoxifen. These women had to have at least 20% of their calories that came from fat at baseline, so it's a pretty low bar. But the goal of this intervention was that they would reduce fat calories to less than 15% of the daily diet, which is a pretty low-fat diet. The other half of the women were randomized to a usual care control group. As you can see here, at baseline, the true groups were pretty well balanced in terms of their dietary fat. It was about 30% of calories, and their weight was also balanced. At the end of the 5-year intervention period, there was about a 1/3 reduction in the percent of calories that came from fat. So they took percentage of fat calories from 30 to 20 in the intervention group. And there was also about a 6-pound weight loss. Now this was not designed as a weight loss trial, but patients who were assigned to the intervention did lose this weight, and they maintained this weight loss over the 5 years of the intervention period. This study was presented now also more than a decade ago. And what it demonstrated was that women who were assigned to this low-fat dietary intervention had a 24% reduction in the risk of their cancer metastasizing. So a pretty significant reduction, and really the first time that something that wasn't a drug, radiation, or surgery had been shown to have an impact on the risk of cancer recurrence. Now, unfortunately, they never did an analysis to look at whether the people who did better were the people who lost weight, but they did show that women who entered the study with a BMI in the obese range were more likely to derive benefit from the intervention than women who weren't. So sort of another kind of secondary way of looking at this, but suggesting that weight may have played a role in the improvements that were seen in women in this study. Now, as an oncologist, I don't tell people that they should consume a low-fat diet as part of their treatment. And the reason for that is that at the same time that the Women's Health Initiative, the Women's Interventional Nutrition Study was being conducted, there was a second study with an almost identical design called the Women's Healthy Eating and Living Study. This was, again, a low-fat dietary intervention trial. The one major difference was that this intervention was delivered by phone instead of in-person groups. Enrolled in almost identical 3,000 women, early breast cancer, finished all the chemotherapy and radiation. Again, patients were randomized to these two interventions, or to the intervention versus control. The intervention was a little bit different. It did seek to lower fat, but they also gave people juicers. They were really focused on increasing fruits, vegetables, and fiber. And in this study, again, you could see that there were significant changes that occurred as a result of the intervention. One thing I do want to point out was that at baseline, these patients were consuming 7 servings of fruits and vegetables, which is not exactly the US norm in terms of diet. So there was not an eligibility criterion that said that you had to have a diet that was high in fat or low in fruits and vegetables. And so this group of patients that took part in this study, many of them were already consuming a diet that was not quite the US norm. But that aside, they did demonstrate that they were able to increase servings of fruits and vegetables to about 10 servings a day. There was about a 7% reduction in dietary fat, but there was no change in weight in this study. Kind of like the Women's Health Initiative that we looked at the beginning, people really kind of decreased their fat but increased their carbs. So it was a little bit of a trade, which that had not been seen as much in the study that we just looked at. And unfortunately, there was absolutely no impact of this intervention on the risk of cancer recurrence. The two curves were completely interposable, and they looked at this in every different way, looking at younger women, older women, women with different kinds of breast cancer. It just did not matter. There was not any benefit of this intervention, despite the fact that people did cut their fat by a bit and increase their fruits, vegetables, and fiber. So one of the questions that has come up from these two studies is, did they study the wrong diet? You know, I think we know a lot more about diets, about carbohydrates, about fat, we don't think about this in such simplistic terms that in order to have a healthy diet, you just need to cut your fat. And so we don't, unfortunately, have a large randomized trial that has looked at the impact of different types of dietary modification on outcomes, but there is a very interesting study that was conducted in a much smaller group of breast cancer survivors. So there were 370 women who were overweight or obese who took part in a trial that was looking at the impact of different kinds of diet on a number of different biomarkers that have been linked to breast cancer recurrence. So this study was too small to see if these different diets actually made a difference in terms of recurrence, but they were looking at things like insulin, hormone levels, and other things that have been linked to breast cancer recurrence. So the study was called CHOICE, and women were given the option. They were randomized to either an intervention or to control, and if they were randomized to intervention, they got to choose whether they wanted a high-carb, low-fat, or low-carb, high-fat diet. And then they looked at how this impacted the risk of looking at different biomarkers. What they found, first of all, was that the decrease in glucose was identical in the two groups of patients that were assigned to either one of the interventions. Fasting leptin, also an identical pattern in both of the intervention arms versus control. They found really that changes in weight were what drove the changes in biomarkers. They saw almost identical weight loss in the two intervention groups. This was a 6-month intervention, so it doesn't really speak to whether people can maintain weight loss over time, but over the 6-month intervention period, the weight loss was identical. And when they looked at how weight change was related to change in biomarkers, they found it didn't matter what diet you ate. If you lost weight, you experienced the same reduction in biomarkers. And so we don't have a trial that suggests that one diet is superior to another, but this type of evidence does suggest that in breast cancer, weight change may be one of the key factors in influencing the risk of recurrence. There is one other study that I want to mention. This has gotten a lot of headlines in the last couple of months. There have been additional analyses as part of this women's health initiative. Now, this study that we talked about has now been following these women for 30 plus years. And in the last 6 months, there have been several publications related to what happened to those women who developed breast cancer while they were taking part in that low-fat dietary arm. So we know that about 3,000 women of that 48, remember when we were, I'm sorry, I know we're covering a lot of different studies, but we talked about this 48,835 woman trial where they showed that eating a low-fat diet did not reduce your risk of developing breast cancer, but they continued to follow those women over time to look at, well, what happens once you develop breast cancer? Does this dietary pattern have any impact on your outcomes? And so this analysis that was published earlier this year, and there's 2 others that are coming up in the next couple of weeks, look at people who were diagnosed with breast and other cancers during the 8.5 years that they were taking part in this dietary intervention. Now, one of the things that the authors of this study point out is that many of these women continued to take part in the low-fat dietary program after they were diagnosed with breast cancer. So this was the time of diagnosis, and this was how much of the intervention people had done before versus after. You can see this is pretty fuzzy, so not everybody continued the intervention, but many people did continue to take part in these low-fat dietary programs after they were diagnosed with breast cancer. Of the women, the 3,000 women who were diagnosed with breast cancer while they were taking part in the intervention, at this point there have been 516 deaths. The majority of them have been from breast cancer, other cancers. Cardiovascular disease accounts for 91 of these deaths, and other causes 130. And what they were able to show is that the risk of dying after being diagnosed with breast cancer was lower in the group of women who were taking part in this low-fat dietary intervention. Now, this is a little complicated because they developed these cancers while they were in the study, so they may be a little bit different cancers. If you were taking part in the low-fat dietary group, maybe that led to a less aggressive cancer, but it's very interesting to note that there was a lower death rate for people who were taking part in the intervention. And so, didn't mean to. So in looking at what did people die of, I think not surprisingly, there was a significant reduction in cardiovascular death in patients that were taking part in this low-fat dietary intervention, but there was also a non-significant reduction in breast cancer death. This has gotten a lot of play in the media, that this low-fat diet was helping to reduce the risk of recurrence in breast cancer. I'm not sure I would go that far with this non-significant reduction, but I think it does suggest that the dietary intervention was potentially doing something that was improving overall health in these patients. Again, a piece of potentially hypothesis-generating information. And the other thing that was interesting was that the relationship between the diet arm and mortality was only seen in women with higher waist circumference. They didn't see a relationship with BMI, but they did with waist circumference. So again, suggesting that body weight may play a role in these factors. There is another analysis that will be printed later this week looking at other obesity-related cancers. And interestingly, breast cancer is the only cancer where there was a better outcome seen after diagnosis in this analysis. So colon cancer, endometrial, there did not seem to be better survival in individuals in the low-fat arm. So why breast cancer would be so different than other malignancies isn't clear. And I think probably this isn't something that should change practice. But when you put all of this information together, it does suggest that weight, other types of energy balance factors after diagnosis could potentially impact outcomes. I think that looking at these trials together, the fact that weight really seemed to drive the changes in biomarkers in choice, that the patients in WINS who lost weight did better, the patients in WELL who did not lose weight did not seem to have an impact of the intervention. This really leads us, again, to thinking that weight change may have an impact on breast cancer outcomes. And that was what led us to develop a randomized trial in women with early breast cancer that will look at whether if you take a woman who's obese when she's diagnosed with breast cancer and you help her lose weight, whether that will have any impact on her risk of recurrence. So this trial is called the Breast Cancer Weight Loss Trial. It is a trial that's being conducted through what's called the intergroup system in the United States, which is a network of more than 1,000 academic and community-based oncology practices. Our goal will be to randomize 3,136 women with higher stage breast cancer. We know that patients with stage 1 breast cancer at this point have 95 to 98% disease-free survival at 5 years, so that's a very good risk population. We're looking for people who have a higher risk of recurrence and mortality. And they're divided into two groups. One takes part in a 2-year telephone-based weight loss intervention, and the other is randomized to a health education alone group. Our primary outcome is breast cancer recurrence, and then we're also looking at overall survival and a number of other endpoints related to their metabolic health, quality of life, and biomarkers. And just as a quick overview, we have been very fortunate to partner with Tom Wadden, who many of you may know in this room, very helpful in helping us to develop our lifestyle intervention. It's a 2-year program, so shorter than things like the diabetes prevention program and the Look Ahead study. It's completely delivered by phone and the web. We have this trial at this point, patients who have joined the trial from 49 of the 50 states, as well as 5 Canadian provinces. So it's really meant to be completely delivered remotely. Patients don't ever meet their coach face-to-face. Each patient who's randomized to the weight loss group has a coach, 42 telephone calls over 2 years, and we also give them a number of tools to facilitate weight loss. We've been really fortunate that groups like Fitbit have partnered with us, Nestle Health Science, to provide protein shakes for patients who are interested. As a little bit of a synopsis, and I realized I sent these slides in about a month ago, and in that time, our enrollment has increased by more than 100 patients, which is exciting. We now have 1,652 patients as of this morning from 49 states. We're just missing Wyoming, if anyone knows of any patients in Wyoming that would be in need of an intervention like this. We have been really, really excited to see the enthusiasm. You know, this is the first trial like this since those trials 30 years ago looking at dietary interventions in breast cancer. So we weren't really sure what the interest level would be, whether people, with all the exciting new drugs, immunotherapy and everything else, whether people would be interested in this approach. And I will say we enrolled our first patient the day after the study started and have been far exceeding the monthly enrollment goals ever since. So it's been really exciting to see how much enthusiasm there has been on the part of patients and on oncologists across the country. So we are hoping that we will finish our enrollment in about 1.5 years. Cancer outcomes take a long time, so we will probably not have our analysis demonstrating whether weight loss actually improves outcomes until about 2023. But I think we're a lot closer to being able to give people definitive advice about the impact of weight change after diagnosis than we were a few years ago, which is exciting. This is just a little bit of a snapshot of who's in our trial. Our average age is about 53. We have about evenly distributed pre- and postmenopausal patients. Our average BMI is 34.4, and I think one of the things, our eligibility allow people to enroll in the study down to a BMI of 27, recognizing that weight gain in the years after breast cancer diagnosis is extremely common. Women gain often on average about 5 kilograms, so we did not restrict this to just people who were obese at diagnosis, recognizing that a subset of patients who are in the higher end of the overweight range will become obese without intervention. We found here, you can see our breakdown of overweight and obese, and then we also have a mixture of different tumor types, so hoping to be able to really explore not only does this work, but who does it work for. This is one of a few randomized trials that are going on now looking at the impact of weight loss or other types of energy balance lifestyle intervention on cancer recurrence and mortality going on around the world. 3 of these trials focus on breast cancer. Our trial, there's a trial called Dieta 5 that's being conducted in Italy looking at a macrobiotic Mediterranean diet, and then a German trial looking at a more traditional low-fat diet. That's called Success C. We also have the Challenge trial, which specifically looks at exercise in colon cancer patients, the LIVES trial looking at a low-fat diet paired with exercise in ovarian cancer, and then a really interesting trial called GAP4, which is looking at high-intensity exercise in men with metastatic prostate cancer to see if it will help them live longer. So not a lot of supportive kind of preliminary evidence in that group, but I think it'll be really interesting in what that shows about people living with more advanced disease and their ability to make lifestyle changes that could potentially impact their outcomes. And here you can just see most of these trials, again, focus on prevention of recurrence with the exception of the prostate cancer trial. So I know that we covered a lot of territory, but I hope to leave you with really a firm feeling that obesity absolutely influences the risk of developing malignancy and the risk of cancer-related mortality in individuals who are diagnosed with the disease. I think there's a lot that we still need to learn about the impact of weight loss interventions and other types of interventions, either to prevent cancer or to prevent recurrence. But I think we're a lot closer to being able to give people definitive information. And I think all of your clinics are going to get a lot busier over the next few years if we're able to demonstrate that changing weight after breast cancer diagnosis, after diagnosis of other diseases, can help people not only feel better, but also live longer and potentially survive their malignancies. Thank you very much.
This has been a Dana Miller Video Network presentation.